So BETonMACE was the first ever phase 3 cardiovascular trial looking at inhibition of this unique group of proteins called bromodomain and extraterminal proteins, BET proteins. It's a small molecule that's taken orally. It's called apabetalone, and apabetalone inhibits these BET proteins. And these BET proteins have epigenetic roles in biologic processes, but when there are inflammatory stimuli that affect these BET proteins and make them work on genes that they're not supposed to work on and induce an inflammatory cascade. Apabetalone in the BETonMACE study looked at randomized patients to apabetalone versus placebo. These were high-risk patients with type 2 diabetes who were immediately post-MI or ACS and who had low HDL. The primary study results were that it was a negative trial. This was likely because it was underpowered. There was a lower than expected event rate in the placebo group, and as well, the modeled effect size of 30% reduction in risk was not achieved in the trial. There were some pre-specified subgroup and secondary endpoint analyses, so there was a nominal significance for a decrease in heart failure hospitalizations, as well as evidence for a benefit of effect in patients with LDL below the median and in GFR below the median. But all of these results have to be viewed with caution as they are exploratory. So in summary, I think this is a really interesting molecule, a really interesting study. However, we have to keep in mind that this was overall a negative clinical trial. But given some of the biology, the fact that we have some pre-specified subgroups that were interesting, and that there was concordance, although not significant, across many of the secondary endpoints, these data do suggest that an adequately powered clinical trial is necessary to fully evaluate the effects of apabetalone on reduction in MACE events.